Hello everyone, welcome to Pediatrics by Dr. Anand. Is my voice audible to everyone? Please put a message in the comment section. Thank you. आवाज आ रही है मेरी शाम वाली क्लास नहीं हो पाई क्यों नहीं हो पाई some instant glitch was there. Let's start this beautiful class. Yes, I can hear my voice and I can hear you all. My name is Dr. Anand. I'm MD Pediatrics working in a medical college as assistant professor. This is one of the most beautiful platform of the Unacademy. The point number one in the Unacademy, why to join Unacademy? The main question is that number one, in the Unacademy, we have some beautiful subscriptions like we have Plus subscription and then we have Iconic subscription. In the Plus subscription, you get amazing access to the live and recorded classes. Educators are really nice and the content quality is really amazing in the Plus subscription. And then we have the Iconic subscription. In the Iconic subscription, you get the Unacademy platform and the Prep Ladder subscription, all the beautiful lecture notes, clinical notes, digital notes, comprehensive printed notes you get on the Iconic subscription. Also in the Unacademy, we have something known as special class where you get amazing all the lecture notes. You never miss the classes because all the lectures are recorded in a proper manner and good live sessions, interactive sessions are there. Good evening, Dr. Kaustubh, Apeksha, Nikita, Suman, Deepak, and Harshita. Beautiful class, beautiful people, beautiful vibes. Let's rock it. In the Unacademy, for the light-hearted, beautiful students, we have the Unacademy Light Pack, which has the previous year question papers and the amazing grand test series for pertaining to the FMGs and also for the UPSC students. If you want to use this, the code is Dr. Anand. You can unlock it and use it anytime, the light subscription. Also at the same time, make sure you guys are free every day at 10 p.m. because we have this subject wise very beautiful subject and the test series. It's like a FMG practice league free test calendar. Okay. For the beautiful UPSC students, we have this a revision batch basically, which is for 1.5 months, which has some amazing faculties who are gonna cover some beautiful subjects pertaining to the UPSC. Sir, please tell me the important question papers. My dear, last 3-year question papers are really important. We have it on the Unacademy app. Go to self-study, practice and subject. You will find the previous year question papers. Anytime on the day, if you get a notification that Dr. Anand has put a daily practice paper, please give them. It will be just 5 MCQs. It will be good for your conceptual understanding. And again, UPSC is really important. It's a very quick 1 and 2 months pack, hardly any price. And this is again a discounted price. If anyone applying for UPSC, use this. The code is Dr. Anand. Next exam is coming for the MBBS student. They are really scared, but no need to get scared now because you have me and the beautiful pack 3, 6 and 12 months pack we have pertaining to the MBBS students. You can enroll whenever you feel comfortable. That's it. Let's start the class. I told you regarding the Plus, Iconic, Light and MBBS first year subscription with a beautiful duration and prices, and the code was Dr. Anand to use some financial benefit. Okay. Yes, let's start the class. Hello Dr. Dev, hello Deepak, hello Vits. Beautiful, we have beautiful students. Let's start this amazing class. The topic of choice is nothing but we are talking about very importantly FMG Rapid Revisions. Actually, this is the episode number 11. We have finished 10 episodes and they are like super hit. Everyone is loving them like crazy. So you also can have it. It's gonna be amazing. Hi Shubham. Shubham, कौन से वाला शुभम है? अपने वाला शुभम है तू? कौन से वाला शुभम है? Okay, great. So hello Manish, let's start. Before starting any beautiful class, we always have a motivating quote, and today's motivating quote is very important. It says that to heal a wound, you need to stop touching it. To heal a wound, you need to stop touching it. Okay, so it's a very deep meaningful thing. Sir, I am not able to forget my past. Sir, I had a very bad childhood. I don't have any friends. Someone stabbed me. Someone is doing backbiting on me. They are abusing me. They are saying bad about me. So you have to forget everything what happened in your life and start your life with a new page, a fresh page and a fresh start. Because to heal a wound, you need to stop touching it. We are always into resentments. We are always into regrets. I wish I had done the paper well. I wish I had done the last year paper well. I wish I had taken that PG seat. Why did I left it? Why did I left it? Why this? Why that? Why this? Why that? To heal a wound, you need to stop touching it. Okay, so move on. बदलते हुए वक्त को अपनाओ. जिंदगी भगवान की एक बहुत महंगी गिफ्ट है. Feel it, love it, live it. Don't just exist, live your life. Be proud of who you are. Talk to yourself. Look in the mirror, your eyes, and just tell you how amazing you are. Okay, you have got the spark. You have got the spark. Is your happiness dependent on someone else? No, it's not. Is your being loved dependent on someone else? No. Whom are you dependent on? I'm dependent on me. I'm dependent on myself. Whom do you love? I love myself. Whom do you appreciate? I appreciate myself. Do you think you can crack this exam? Obviously, my goodness, yes, I was born to crack this exam. That much of, attitude you should have, okay? So you are on your own, and that is the best thing about you. At least you will not ditch yourself, right? So to heal a wound, you need to stop touching it. Let's start this beautiful class. Yes, exactly. Today's topic of choice is the continuation of the torch profile. We were studying about the torch profile yesterday, right? We covered the congenital toxoplasmosis. In the others was syphilis. Yesterday we beautifully covered the congenital syphilis triad, which was the Hutchinson's triad, right? Hutchinson's triad. Beautiful, perfect. Let's start with the continuation series. In the others only, you have very important varicella, right? Varicella, nothing but chickenpox. This is a very important class. Remember that. Okay, so varicella. So FMG question number 1, what is the congenital varicella syndrome triad? Okay, can anyone please tell me? Yes, Dr. Target Ames, good evening. Hello, how are you? Dr. Kaustubh says sir 10th वाले एपिसोड का क्या होगा, मैं दोबारा उसको रिकॉर्ड करूंगा क्योंकि कुछ इंटरनेट का प्रॉब्लम, मतलब वो पीछे बैकएंड से प्रॉब्लम था. I will put it again, so no problem, chill. Okay. Yeah, so the triad of congenital varicella syndrome are, please put your best positive vibes in this class and just rock this class like anything. So the congenital varicella syndrome triad, number 1, this baby is having some lesions, right? Can we appreciate some lesions over here? So these are cicatricial skin lesions, number 1. These are cicatricial skin lesions, number 1. Number 2, there is what can we appreciate in this one, dear? Is this phocomelia? Yes or no? Is this phocomelia? Yes or no? What do you think? Osama, Dr. Osama, good evening, Dr. Osama. So yes or no? The answer is no. This one is not phocomelia. If I would have to show you the picture of phocomelia, all 4 limbs would be hypoplasia. All 4 limbs would be affected. Can you see his upper limbs are perfectly, his upper limbs are there, okay? Only hypoplasia of the lower limbs. So Dr. Kaustubh, remember, okay? Akshay, this one is not phocomelia. Phocomelia is all चारों हाथों पांव छोटे होते हैं. All 4 limbs are small. In this is nothing but a hypoplasia of the lower limbs. Hypoplasia of the lower limbs, right? And where have you read phocomelia? Could you please tell me? Yes, very good. If the mother has taken thalidomide drug during pregnancy, the baby can land up into phocomelia, right? And what are we studying over here? We are studying congenital varicella syndrome. The triad of congenital varicella syndrome is, number 1, cicatricial, मतलब बहुत ही drastically bad, very contagious, very badly spreaded. So cicatricial skin lesions, hypoplasia of the lower limbs, and also the mother having history of fever with rash in the first or second trimester. This is the beautiful triad of congenital varicella syndrome. Perfect. Apeksha, very good. Suman, perfect. Pragya, Swaraj, शुभम तू कौन से वाला शुभम है? अपने हमारे वाला शुभम है तो कोई और शुभम है? हमारा एक बहुत अच्छा फ्रेंड है शुभम हमारे ग्रुप के अंदर, सो आई एम आस्किंग यू. निष्ठा अमृत से हूँ, वेरी गुड, परफेक्ट, ब्यूटीफुल स्टूडेंट्स आंसरिंग, ब्यूटीफुल आंसर. सो दिस इज नथिंग बट द congenital varicella syndrome triad, cicatricial skin lesions, hypoplasia of the lower limbs, and अपना क्या बोलते हैं उसको, हिस्ट्री ऑफ फीवर विद रैश इन द फर्स्ट और सेकेंड ट्रिमेस्टर. तुम अपने शुभम हो, ठीक है, चलो अच्छी बात है, वेरी गुड. Hello, Dr. Yogesh, Shubham. ठीक है, okay. And okay, how do you confirm? The question was congenital varicella syndrome. If I have varicella virus in my body, then how will you confirm? Can I write anti-varicella zoster virus antibody? Yes or no? Like the way in congenital toxoplasmosis, I had that anti-toxoplasma IgM, right? Here also same we have, if I have a varicella zoster virus, then there will be antibody against it, right? So in my body, how will I confirm it? By anti-varicella zoster virus antibody. You know, right? Whenever an antigen enters in my body, antibodies are formed against that, right? So if I really have this virus, this antigen, so I definitely must have the antibody. So anti-varicella zoster virus antibody. Perfect, very good. Okay, yeah. Now, next important point. So we are again studying TORCH. Let's put this class some very beautiful vibes and let's just finish the whole syllabus. Congenital toxoplasmosis was covered in the last class. In the others, we had syphilis, which was covered earlier. Rubella, this one, what do you call? Just now I told you about this one. Apna kya bolte hain isko? Varicella. And now we have this one, rubella. Can you please tell me question number 1, FMG entrance question number 1, which is the most severe form of intrauterine infection? Yes, very good, Dr. Shubhangi Kaushik, Lokesh, target aims. The most severe form of intrauterine infection is congenital rubella. Rubella is the most severe form of infection. And which one has recurrent abortions? Dr. Shubham, which congenital infection has recurrent abortion? Hanji, and recurrent abortion किससे मिलता है? Exactly, syphilis. In syphilis, you see recurrent abortion. The most severe form of intrauterine infection is congenital rubella. And among this TORCH, which one is most common? Is rubella common, cytomegalo common, H common? Which is the most common? So C for common. Yesterday only we spoke about it. C for common, C for cytomegalovirus. CMV is the most commonest one. I hope you are beautifully getting it. Perfect, perfect, very beautiful. We have amazing, beautiful students in our class and they are answering amazing. Okay, yeah, so rubella, number 1, rubella is the most severe form of intrauterine infection. Number 2, very important, yeah, this is the good one. Do you remember, my dear friends, in yesterday's class, I told you there are some infection which are there, which a mother can get in the first trimester, second trimester and third trimester. Could you please tell me which was that infection we were talking that in the first trimester is really very important? If the mother get a dash infection in the first trimester, the baby can have defect. The answer was rubella only, right? You remember that? Yesterday we spoke about it. Exactly. And what about third trimester? Can anyone please tell me any one example where if the mother has the infection in the third trimester, it is really, really bad? It can affect the baby. Yes, very good, very good. So beautiful answer. Toxoplasmosis. Yes or no? We spoke about it, right? Toxoplasmosis increases. Yeah, even CMV also, mainly toxoplasmosis definitely increases once the trimester increases, right? Yeah, very good. And rubella has the highest chances in the first trimester. So FMG question number 10, if the mother is in less than 11 weeks period of gestation, if the mother is pregnant, her baby is less than 11 weeks period of gestation, could you please tell me how many % chances are there that the baby will have defect? Anyone? 60%, 70%, 80%, 90%? Dr. Osama, Manish, Suman, Sona, Akshay, Nikita, Lokesh, and Abhineet, and our dear Dr. Shubham and Osama. Yes, beautiful. So 90%. 90 sounds the better answer told by Amrit. Very good, Dr. Amrit. Very good. So please, again, whatever we are reading this for the first and last time, okay? So don't just revise here only. Finish it. हफ्ते में पेपर है, खत्म करो कहानी, ठीक है? So I'll repeat again. Which in the first trimester, which torch infection is really very common? The answer is rubella. Number 1. Number 2, how many % chances are there? If the mother has got an infection in less than 11 weeks period of gestation, 90% chances are there that baby will have defect. And very important, if the mother has got the infection in 11 to 12 weeks of life, then how many % are there? Just 33%. From 90, it is just 33% chances are there if the mother has got an infection of the rubella. This is very drastic, okay? You told 80 to 90 चलेगा dear, 80 to 90 range हमेशा होती है, तो कोई टेंशन वाली बात है नहीं. Okay, so can we therefore write this line? More the weeks pass, less is the frequency of congenital rubella syndrome infection. And in a case of congenital toxoplasmosis, more the weeks pass, more the infection is there in congenital toxoplasmosis. Perfect. Next question. Okay. And also very important, see, this is important, okay? In rubella, of course, everyone knows the congenital rubella syndrome triad is cafe coffee day. We're going to talk about it. The rashes in the rubella patient is similar like measles rash, like the presentation is same like measles rash, but rash appear on the day 1 and it lasts for 3 days. Very star mark important question. Congenital rubella syndrome is also known as 3 days measles. Why? Because the rash appears like a measles rash only, but can you tell me normally measles, in the measles, Dr. Shubham, Fever with rash on which day comes in measles? If I've got a fever today, then in how many days are you expecting I will have the rash for the measles? Like after day 1, day 2, day 3, day 4? Yes. Okay, Dr. Suman, what do you think exactly? Nikita has the perfect answer. Fever with rash on day 4. If today I have got a fever, at the 4th day after my fever, I will have a rash. I will have a rash. And what kind of rash do you see in a case of measles? Do you see centripetal rash or do you see centrifugal rash? Could you please tell me centripetal or centrifugal? कौन बताएगा? Any guesses? Pragya, Akshay, Mahira, Dog Derm, Abhinay, Nishtha, and Arsh Gautam. Okay, Arsh says centrifugal. You sure about it? बेटा इधर आओ, इधर उल्टे हो जाओ, तुम्हें धक्का दे दूं मैं, धक्का तुम्हें धक्का दे दिया मैंने, ठीक है। हाँ, सो ऐसे धक्का करो अपने आप को, हाँ धक्का खा लिया, क्यों? क्योंकि मीजल्स एंड चिकन पॉक्स, मीजल्स एंड चिकन पॉक्स, यू नो राइट, द रैश ऑफ द मीजल्स स्टार्ट बिहाइंड द ईयर, देन गोज द फेस एंड देन ट्रंक एंड द बॉडी एंड लोअर लिम्स, बट इट इज अ सेंट्रीपीटल रैश। पीटल मतलब पेट की तरफ ज्यादा होता है, टुवर्ड्स द टमी एरिया, द डिस्ट्रीब्यूशन ऑफ रैश इज मोर टुवर्ड्स द टमी एरिया, पेट वाला एरिया, so that is centripetal. Measles and chickenpox has a centripetal rash. डॉक्टर ओसामा बेटा ढंग से जवाब दे दे, जान से मार दूंगा। हाँ जी, फ्यूगल कैसे? फ्यूगल इधर, तू इधर आ जा, कैसे? इधर आओ, चप्पल कहाँ है मेरी? फ्यूगल कैसे हुआ ये रैश? फ्यूगल में क्या होता है? फ्यूगल में द डिस्ट्रीब्यूशन ऑफ द रैश, एफ फॉर फ्यूगल, एफ फॉर फार, द डिस्ट्रीब्यूशन ऑफ रैश इज मोर टुवर्ड्स द पेरिफेरी, नॉट इन द सेंटर। इन डिस्ट्रीब्यूशन ऑफ रैश मोर इन द सेंटर, सीन इन मीजल्स एंड चिकन पॉक्स। एंड फ्यूगल के एग्जांपल्स क्या थे, कौन बताएगा? परफेक्ट, प्रज्ञा हैज टोल्ड वेरी ब्यूटिफुली दैट नथिंग बट हैंड, फुट एंड माउथ डिजीज, HFMD, and also very importantly, anyone, हाँ जी, small pox also, yes, small pox and HFMD usually centrifugal rash. Hello Dr. Amit, hello Dr. Pradesha, hey sir, just now joined. Okay, just 20 minutes are over. Where were you? Why you joined late? Why you joined late? Go stand. You will not sit in the class, you will stand and attend the class. Punishment. Okay, so please can we therefore appreciate this picture that the what is 3-day measles? Congenital rubella syndrome is known as 3 days measles. Why? Because sir, generally in measles you get a fever with rash on day 4, but in congenital rubella, look, the rash will look like a measles only, like a behind the ear and face and trunk and this and that, but it is not present at the day 4. It appears on the day 1 and lasts for 3 days. That is why it is also known as 3 days measles. That's it. Okay, great. Okay, Dr. Mia says got late notifications. Okay, that's nice. Perfect. Okay, let's go further. Dr. Ediga says beauty. What is beauty? I didn't get you. And also star mark. Dear, whatever star mark I'm getting, it's a exam question. It is an exam question. Congenital rubella syndrome has some spots, and that is known as Forsheimer spots. That's another very important exam question. Where do you see Forsheimer spots? The answer is congenital rubella infection. Not in syndrome, but in congenital rubella infection, you see Forsheimer spots. It's a very beautiful exam question. Yeah, exactly. Okay, and Forsheimer spots कहाँ होते हैं ये? See, Forsheimer, Forsheimer में R है ना, R for rubella. Okay, rubella infection, you get Forsheimer spots, and these are nothing but red spots over the palate. Red spots over the palate. Please don't confuse the Forsheimer spots with the Nagayama spot. Have you heard of Nagayama spot? Where do you see Nagayama spot? Dr. Shubhangi says, sir, मैंने आपको कुछ भेजा था, आपने देखा नहीं. Sorry dear, अब भी जिम से आया हूँ dear, बस मैं देखता हूँ, ठीक है, पक्का देखता हूँ, ठीक है. वो वाला देखा था मैंने, वो जो एक्सेप्ट और एक्सपेक्ट वाला जो तुमने बताया था मुझे. Yeah. Okay, Pradesha says, sir, one doubt that the Koplik spots in measles is a rash. Koplik spots basically, which is a pathognomic sign of measles. I'm going to show you the picture also. It is on my cheek. It is on my cheek. Okay, a Koplik spot. Let me just show you right now. As you just spoke about Koplik spots, our continuation is nothing but most importantly Koplik spots. This one, dear. Can we? What is this picture? It could be a very important exam. This. Can you see this white? Can you see this white dots which are there? This is nothing but very importantly coplic spots, and they are opposite the first molar. They are on the cheek. Okay, can you see cheek? So can you please write this? They are the coplic spots are the red lesions with bluish white spots. Can you see the whitish spots over here? So they are like the white spots in the center on the inner aspect of the cheek at the level of first and second molar. This is a very beautiful picture of coplic spots. Okay, coplic spots. ठीक है, rash एक तरह के ये क्या है, lesions हैं, red lesion with the white center. Did you understand, Dr. Pradesha dear? Okay, let's move further. Very beautiful. We have covered the whole picture. Okay, life is beautiful. Finish it off. That's it. And yeah, Scheimer spots. It is seen in congenital rubella infection. And could you please tell me Nagayama spot? I think just now someone has told already. Perfect. Nagayama spot is seen in roseola infantum. Very good. Nagayama spot is seen in roseola infantum. Scheimer spot, it is seen in rubella infection. Remember that. Okay, beautiful. Pragya says second molar or first molar? First and second molar, both are the answers. ठीक है, perfect, very good Amrit, very good Swaraj. Shubham कहाँ पे है? ठीक है, very good. Seen on day, which day? Coplic spots usually fourth day you see, fourth day. We're gonna talk about coplic, measles will come, infectious disease आएगा भी, थोड़ा शांति रखो, ठीक है? And everyone knows about the triad of congenital rubella syndrome. Can we have the quick one? What is the triad of congenital rubella syndrome? The answer is cafe coffee day. What is cafe coffee day? Congenital heart disease. Then we have cataract, and then we have deafness. That's it. Cafe coffee day. And which is the, okay, so we have three questions. Okay, number one, what is the what do you call name of the congenital rubella syndrome triad? Can you tell me, does this thing has a name? Congenital rubella syndrome is also known as dash triad. What is that name? शुभम कहाँ पे है? शुभम कहाँ है तू? चक्कर खाए गिर जाएगा, इधर आ जा तू. शुभांगी बताओ, इसका पढ़ के आई हो ना, बताओ शुभांगी, आंसर बताओ. My question is, congenital rubella syndrome has a triad, of course, cafe coffee day. What is the name of the triad? The answer is, it is known as Greg's triad. Please remember, Pragya has a beautiful answer, Greg's triad. Perfect, Gunjan. Yes. So Greg's triad, वो क्या होता है? Everyone knows about it. The triad is nothing but congenital heart disease. The most common congenital heart disease in congenital rubella syndrome is PDA. Okay, there are three questions. Number one, which is the most common congenital heart disease in congenital rubella? The answer is patent ductus arteriosus. And what is the triad? The triad is cafe coffee day. Which is the most common manifestation? In congenital rubella? What's the answer? Yes, the answer is deafness is the most commonest. Deafness is the most commonest manifestation in congenital rubella syndrome. And could you please tell me in congenital toxoplasmosis? Which is the most common manifestation in congenital toxoplasmosis? कौन बताएगा? जल्दी बताओ, जल्दी से. Do you remember, guys? Yesterday we have done, see, revision plays a very important role, bro. Now tell me, do you remember, right? Congenital toxoplasmosis has a very beautiful triad of hydrocephalus. We have intracranial diffuse calcifications and chorioretinitis. Yeah, the most common manifestation to देखा जाता है C for common, C for chorioretinitis. Remember that we have done that, right? Beautiful. Please put a like button to this video. Are you able to understand? Half an hour is over. Okay, just 20 minutes left, then this class is over. Great. You can put a blue heart or a black heart or a green heart. समझ में आ रहा है शुभम? समझ में आ रहा है पांचल? समझ में आ रहा है डियर? ठीक है, perfect, sounds good. And also this also, let's quickly revise. And what do you call this? Very importantly, can we quickly, let's finish the whole book together, my dear friends. Yes, Dr. Suman. शुभम कहाँ पे है? शुभांगी, my dear Dr. Shubhangi Kaushik, who is so beautifully answering well and such a beautiful person by heart. She loves dogs. And yeah, so ये कौन है ये? कौन है ये? Knock knees. Okay, cute. Other than knock, yeah, can I write Clutton's joint? Very important. This is nothing but Clutton's joint. Where do you see Clutton's joint? Could you please tell me? I forgot. Pradesha, where do you see Clutton's joint? And if I talk about torch infection, what is this Clutton's joint? Seen in congenital what congenital? कहाँ मिलता है ये? Syphilis, exactly, syphilis. And what was this sign? Dr. Manish, Dr. Divya, what was this sign? Osama, Akshay, Suman, शुभम कहाँ पे है? मनीष, हाँ ठीक है, यस बडी, वेरी गुड शुभम, अमित वेरी गुड, प्रदेशा, व्हाट इज दिस? कौन है ये? तुम्हारे घर कौन है ये? क्या क्या है ये? चिकन बिरयानी है? क्या है ये? यस, दिस इज हिगमिनिस्कीज साइन, यू रिमेंबर दैट? यस और नो? आई नीड टू नो द स्पेलिंग। बेटा गलत किया ना, तुम देख लो। ओसामा तू आंसर नहीं कर रहा, अब तेरे को ब्लॉक करता हूँ, अभी तेरे को ब्लॉक करूंगा अपने मोबाइल से, देख तू। फिर तू मैसेज करेगा, प्लीज अनब्लॉक मी सर, सॉरी सर, आई विल आंसर प्रॉपर्ली सर, सर प्लीज अनब्लॉक मी, आनंद सर प्लीज, ऐसे लाइक दैट यू मैसेज मी। आंसर कहाँ है तेरा? ठीक है। डॉक्टर प्रदेशा says I am weak in this chapter but one day you will be the strongest. So Higaminsky's sign is nothing but a thickening of the medial portion of the clavicle, medial portion of the clavicle known as Higaminsky's sign. That's true. Kosu says Osama tired हो गया है, जिम करके आया है, क्या करके आया है Osama जो tired हो गया इतना? ठीक है, लेट्स मूव फर्दर। यस, सो कैफे कॉफी डे ओवर, कंजेनाइटल रुबेला ओवर। विच इज द मोस्ट कॉमन कंजेनाइटल हार्ट एंड कंजेनाइटल रुबेला सिंड्रोम? मोस्ट कॉमन एंड लीस्ट कॉमन, कुड यू प्लीज टेल मी एनीवन? यस एग्जैक्टली सर, डू वी नीड टू बीट चिल्ड्रन? Which children? We don't beat children, dear. Hanji. So yeah, what do you think? Exactly. So the most common congenital heart, of course, is PDA. This Oscar कोई पता है ये तो? Least common. Could you please tell me least common, anyone? Least common. सबसे ऊपर कौन है? PDA से ऊपर, above the PDA we have VSD, right? And above the VSD we have ASD. Just remember this one, dear, that normally, yeah, this one, right? So the most common congenital heart in congenital rubella is PDA and the least common one is ASD. The least common one is ASD, remember. Okay, perfect. Next question. And which is the most commonest component in congenital rubella? Cafe coffee day. D for deafness, that is also over. Will they have microcephaly or macrocephaly? This is a good question. Could you please tell me, in congenital rubella, will they have micro or macrocephaly? Yes, very good, so beautiful. Shubham, Mia, Shubhangi, Pradesha, beautiful buddy. Yes, they will have microcephaly. Microcephaly is defined as Dr. Akshay says macrocephaly. तू बाहर मिल मेरे को। हाँ जी, yeah, head circumference less than -3 standard deviation for the respective age and sex is microcephaly, and that's what, perfect. ठीक है, they will have microcephaly. And what do you call this very beautiful picture, guys? Could you please tell me, anyone? Ocular and skin lesions. Okay, Dr. Manish Yadav and Dr. Amit Kumar, बेटा सुधर जाओ, -2 नहीं है, तुम्हारा नहीं पूछा मैंने, नॉर्मल पूछा है. सो माइक्रोकेफेली इज लेस देन -3 स्टैंडर्ड डेविएशन. मैक्रोकेफेली यू कैन से मोर देन 2, बट माइक्रो इज लेस देन -3. ओके, perfect. हाँ जी, आगे बढ़ते हैं. Exactly. Can I say salt and pepper retinopathy? See this one second. What is this? This is salt and pepper. Who likes salt and pepper? This is salt and pepper retinopathy. Very, very important exam question. Where do you see salt and pepper retinopathy? The answer is again congenital rubella syndrome. Number 1, salt and pepper retinopathy. And also very important, what is this? Beautiful. कोई muffin खाता है? Muffin? हाँ जी, डॉक्टर शुभम, तुम तो मोटे हो, तुम तो खाते होगे, right? So yeah, blueberry muffin rash, right? Very beautiful question. Where do you see blueberry muffins? It's like a blueberry, okay? Blueberry muffin rash. This picture also blueberry muffin, and this picture also like a blueberry muffin rash. So where do you see blueberry muffin rash? In many conditions you see blueberry muffin rash, but one of the conditions is congenital rubella syndrome. Okay, Kaustuv says I hate pepper. Okay, Manish, salt and pepper, blueberry muffin rash, salt and pepper. Yes, Dr. Suman, Dr. Shubhangi, Shubham, Nikita, Shubham, Pragya, Dhanashri, and Kaustuv Mandal. Perfecto. We have perfect students. Beautiful. We all are one family, guys. You have to clear this exam. We have to clear this. We have to clear this exam. That's it. Okay. Remember, whatever you're reading for the first and last time. Even though you're in second and third year also, just do that way. अच्छा, जूली आ गई घूमते फिरते हैं. नीट पीजी रिकॉल कब होगा? अगले जन्म में होगा. मिलो कि अगले जन्म में करेंगे. कुछ दिन में होगा ब्रो, मेरे को टाइम नहीं लग रहा, मेरी ड्यूटीज बहुत एक्टिव जा रही हैं. मैंने इकट्ठे कर लिए हैं क्वेश्चन, बट मैं थोड़ा सा वो करके टाइम लग रहा है. हाँ जी, ऑल विल पास. yes. Perfect. And how do you diagnose congenital rubella? Now, very important. How do you diagnose congenital varicella, anyone? congenital varicella, so you will have a anti-varicella zoster virus antibody, yes or no? Will you have that? Yes, exactly, you'll have that. And how do you diagnose congenital rubella? In the urine sample or saliva sample? Now this is very important, okay? In the congenital rubella you will have IgM antibody in the fetal blood. This is important. Same, no, in toxoplasmosis also you have a IgM antibody for toxoplasma. In congenital chickenpox varicella you have anti-varicella zoster antibody, and here also you have same IgM antibody in the fetal blood, in the fetal blood, okay, in the case of rubella, okay, yeah. And cytomegalovirus, yes, among the, so now the next point we have is we are finishing torch profile, which is the most common infection among the whole torch. The answer is cytomegalovirus is the most commonest infection among the whole torch. How do you differentiate this cytomegalovirus from any other problem? So the answer for that is congenital toxoplasmosis triad and congenital cytomegalovirus triad is exactly the same, okay? The only difference, I told you, what is the difference? We have done this before. Yes, Dr. Amit, RP, Akshay, Swaraj, Osama and Pradesha, Nikita. In the toxoplasmosis you will have intracranial diffuse calcification, whereas in cytomegalovirus, very characteristic. Can we appreciate this picture? Yes or no? Can you see this white spot? What are this? Periventricular calcification you will see in cytomegalovirus, whereas in a case of what we called congenital toxoplasmosis you will see intracranial diffuse calcifications. Is everyone understanding this much? Please put a like button or a heart. समझ में आ रहा है या नहीं आ रहा? 40 minutes are over, just 10 more minutes are left, then this class is over. Okay. ठीक है, perfect. चलो ठीक है, आगे बढ़ते हैं. Yeah, this is a good one. This question, हाँ प्रज्ञा बताता हूँ treatment. Yes, exactly. Sir, do we, now you don't get PDF for this, I'm sorry, no PDF for this one. Okay, yeah, now next question, very important. Congenital cytomegalovirus infection, CMV, which is the most common long-term sequelae. This is a new question for FMGs. Which is the most common long-term sequelae associated with congenital what you called cytomegalovirus infection? नहीं मूड ठीक है जानू मेरा, नहीं गुड्डू ठीक है मेरा मूड ठीक है, बस मैं थक गया हूँ यार, वो जिम करके आया ना अभी, इसलिए थक गया हूँ मैं डियर, और कुछ नहीं. हाँ, so the best answer, yes, nothing but deafness, hearing loss. The most common long-term problem associated with congenital cytomegalovirus is nothing but deafness. Okay, perfect, very good. And how do you diagnose cytomegalovirus? Now this is an important question, guys. Usually the triple star mark, this is a different answer. To diagnose cytomegalovirus, the best sample you have is the urine. This is important, okay? This is urine. The urine is the best sample in this one, okay? Remember that the best sample to diagnose cytomegalovirus is CMV PCR urine. We have an AIM question. Let's see, I'll show you this one. This came in AIM number 2017. A child presented with microcephaly, hepatomegaly, periventricular calcification. Best site from where specimen should be obtained for CMV infection by PCR is which one? What do you think? A, B, C, D? Exactly. We have the urine sample. Urine sample. That's true. Pradesha. Yes, yes, yes. Dr. Kostu, क्या किया? आज bro मेरा बैग था. आज मेरी बैग. This is small, no? छोटे से हैं. बड़े कब होंगे? Could you please tell me how to increase biceps? Please tell me. God bless you. Very sweet of you. Yes, exactly. 250 gram biceps. Cute. Perfect. ठीक है. That finishes this whole thing. Okay. Now we are, yeah. That finishes torch infection. Beautifully done. Let's cover the next half of the topic. Very important. By eating momos, you'll get biceps. No momos, no momos. So guys, what did you do? I want to know. शाम को क्या किया सबने? Okay, निकिता सेज आज स्टोरी नहीं डाली जिम की. मैं सच में बिल्कुल टाइम ही नहीं मिला मेरे को यार, टाइम ही नहीं मिला. 8:20 पे मैं घर आया हूँ. 10 मिनट में मैंने दलिया खाया है और 5 अंडे खाए हैं और फिर मैं बैठ गया यहाँ पे. तो अभी 9:30 डालेंगे 9:30 स्टोरी. मनीष सेज सर हमारे ही नहीं आपको कहाँ से बताएं। अच्छा ठीक है अच्छा डॉक्टर सुमन प्रोस्थेटिक्स फॉर इंक्रीज बाइसेप्स रियली प्रोस्थेटिक्स रियली नो प्रोस्थेटिक्स natural body I've got six packs abs also you know six packs I've got my instructor is like you are doing very good and I'm telling my instructor I'm eating lot of fat food you eat fat food I'm eating malai and curd malai is good you eat everything Dr. Anand your body is amazing people are getting inspired by you so I was like okay great Hmm. Yes, Abhineet. Yes, I am there. Just type pediatrics by Dr. Anand. Somewhere you will find me. Okay. हाँ चना अच्छा होता है. So let's continue this beautiful one. So yeah, what did you do, guys, in the evening? I want to know. आप सबने क्या किया? Okay. हाँ जी क्या क्या किया? Anyone went for singing today? Anyone good in dance classes? I know about Shubhangi. Shubhangi is very beautiful in singing. So anyone? Dr. Shubham, तेरी फोटो सेंड की तूने मुझे? डॉक्टर शुभम इधर इधर तेरे को ब्लॉक कर दूंगा मोबाइल से फिर बोलता रही हो मुझे ठीक है हाँ जी Okay, good. I like, see, we all should have. All India rank 7 girl. She used to say that, sir, every day 30 minutes, 7:30 to 8 o'clock with my this colony mate, one girl is there. I play badminton. And 7:30 to 8 o'clock, proper full Josh, I play badminton. It's a fixed time she plays badminton every day. Even one day before her exam also, she was playing badminton. 8 o'clock, she's so fresh because she did something she loved, right? So she's so fresh. She's like, I studied again amazingly every day from 8 p.m. to 10 p.m. Then 10 p.m. she used to sleep and morning 4 o'clock she used to get up again and then do the whole cycle. Okay, exactly. आशीष कह रहा है मैंने मेडिसिन का रिवाइज किया. Good. Okay, no problem. Exactly. Okay. Yeah. Gunjan says, I do socialize for an hour. Socialize? Are you connected with some NGO? भारत में कुछ गरीबी के लिए तुम कुछ मिटाने के लिए कोशिश कर रही हो? Okay. Dr. Suman, gardening. Beautiful, dear. I love. That's nice. One of my friend, he likes gardening. Send me the photo of how you do gardening and all. Workout, Pragya. Which workout? Are you doing Zumba? So anyone doing Pilates, Zumba, or you like more of physical fitness? So, शुभम तूने क्या किया शाम को बेटे क्या किया भाई को बताएगा आपने Great. So let's move further. So now the next half of the topic is going to be crazy questions. So before starting, we again have a motivating quote, and beautiful motivating quote is what it says. You have a daily income. You have a daily income of 86,400 seconds. Spend wisely. You have a daily income of 86,400 seconds. In 24 hours, you have 86,400 seconds. So you have a daily income of 86,400 seconds. Please send them, spend them very, very, very wisely. Okay, so next topic is this one. Now let's talk about infectious disease and little bit on hematology. I have three crazy questions for you. A 5-year-old child with a low retic count, low serum iron, low ferritin, and increased total iron binding capacity. So what's the best answer? What do you think? Anyone? गुंजन सेज सर सॉन्ग प्लीज एंड में सुनाएंगे एंड में पर सॉन्ग मुझे ओसामा मना करता है सॉन्ग के लिए ना ओसामा कहता है कि आप पुराने गाने सुनाते हो तो ओसामा हैज टोल्ड मी नॉट टू सिंग इन फ्रंट ऑफ एवरीवन बिकॉज ओसामा सेज दैट आई सिंग ओल्ड सॉन्ग सो ओसामा हैज टोल्ड मी नो That's it. Hanji, what's the best answer, anyone? What's the best answer? Yes, low retic count, low serum iron. समझ के पढ़ना. Please have a concept. Okay, we will rock this exam. You must have a concept. Hanji, anyone? Okay, okay. ओके ग्रेट ABCD 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 ADCB अच्छा भैया सोच लो पहले सबने किसी ने A भी बोल दिया है C भी बोल दिया है D भी बोल दिया है कोई रह गया तो बताओ शुभम कह रहा है सर प्लीज चेक योर फोन हाँ मेरा वो व्हाट्सएप हैंग हो रहा है ब्रो तेरा आ गया ऊपर से नोटिफिकेशन अभी देखता हूँ मैं डबल चेक करता हूँ तेरे को मैं अभी रुक जा हाँ सो सी इट्स वेरी इजी ब्रो इट्स वेरी इजी if I'm having iron deficiency anemia, think okay, if I'm having iron deficiency anemia, what will happen to my serum iron? Naturally it will be low, right? And of course the storage form, the main ferritin for the iron deficiency anemia, what happened to serum ferritin level? That will be low. And a compensatory, I will call the total iron binding capacity people to make more and more iron, right? Because I have a low serum iron, so TIBC will increase and there will be low serum iron and low serum ferritin in a basic case of iron deficiency anemia. So the take home message, naturally in a serum iron and serum ferritin will be low and compensatory increase in the total iron binding capacity. Yes, exactly. Yes, समझ में आ गया? Okay, great. अब we have a next beautiful question. This one. Now this is a very strange question. This patient is having high ferritin and low TIBC. Ferritin is very high and TIBC is low and low serum iron also. Now what do you think? Do you think it's iron deficiency anemia? But iron deficiency anemia has a low ferritin and a high TIBC, but this case has a high ferritin and low TIBC with low serum iron. So what do you think, my dear? What do you think? Dr. Pradesha is right. Low retic count was confusing. See, naturally retic count, right? What is reticulocyte? Reticulocyte count, retic, right? Reticulocytes are the precursors of RBC. No, they are the immature form who are devoid of nucleus, and they are the precursor or premature form of the main erythroblast, main RBC, right? If I'm having iron deficiency anemia, my retic count also will fall, right? Because iron is not there only, no, RBCs are not forming only, right? So I will have a low retic count, low iron count, low ferritin count, but a high TIBC in a case of iron deficiency anemia. What is the answer for this question? What do you think, guys? Exactly, beautifully told by Avnish, Div and Husam Uddin. The inflammatory marker, which is the inflammatory marker for a chronic illness, the inflammatory marker for any chronic illness is ferritin. So if I have a osteomyelitis, if I have a bone problem, chronic TB I have, okay, in a case of chronic illness, inflammatory marker for any chronic disease is ferritin. So the patient will have a high ferritin and a low total iron binding capacity. Very beautiful question. Are you understanding, guys? That's how the question is going to come. So A is the best answer. Next one. Now this is a good one. Could you please read this question and tell me? Very good, very good, Amnish. So beautiful. We have amazing student. Yeah, exactly. जो कौस्तुभ says अब आ गया, अब आगे से गलत नहीं होगा. Very good, मेरे प्यारे भाई. Very good, very good, very good. We have to rock this exam. Okay, life is just one. Life is just one. Don't just exist, live, enrich, enjoy, just be crazy, be the craziest version of yourself. People should be envy from you that, oh my god, why is he happy so much? You got तुम्हारी lottery लगी क्या? Yes, lottery लगा मेरा. कौन सी lottery लगी? I just realized how special I am. I just realized I have just one life to live. I just realized that I am best. That's it. Okay, yeah, the best answer for this question is, of course, if I have an acute inflammatory disease, right? If I have an acute inflammatory disease, very clear cut question. See, I don't know what else we have to read, but ESR and CRP elevated without any doubt. In a chronic illness, you won't have ESR and CRP elevated, right? ESR and CRP are the acute phase reactants. If 2 days I have this fever, 1 day fever, 2 days fever, 3-4 days fever, my ESR and CRP definitely will be raised. In an acute illness, we have a ESR and CRP elevated. So that's what. Did you understand, guys? If there was low serum ferritin and high total iron binding capacity, iron deficiency anemia. If this is opposite, that the iron is low and high ferritin, very important, and low TIBC, high ferritin, okay, only high ferritin in a very important chronic, okay, in a the inflammatory marker for chronic illness is ferritin. Inflammatory marker for chronic illness is ferritin, and also then if I have ESR and CRP elevated, then it's acute inflammatory disease. Okay, coming to the day of appearance of rash. Now coming to the infectious disease, as our dear friends were saying that sir, infectious disease is really important and this and that, and so we're going to start with infectious disease. Are you ready? Please put a thumbs up, please put a like button. Shall we start? Are you okay? You want to take a break, or is everyone alive still? Inflammatory marker of any chronic illness is serum ferritin. That's what you should remember. Okay, yes, okay, that's what I said you. Okay, Dr. Akshay says breastfeeding topic. Breastfeeding is very easy. Okay, tonight 11 p.m. we have a class. I need to talk to you. Tonight 11 p.m. we have a class. Do you want to revise breastfeeding, or do you want to revise milestones, or do you want to revise something else, or you want to revise vaccines? Please quickly tell me. Breastfeeding, milestones, or vaccines? Side markers. Okay, yeah. Anyone? Okay. So yeah, tell me very quickly, please. पहले क्या कर? सब कुछ करना है. Everything you want to discuss? Everything? Dr. Pradesha has a valid point. Milestones in the daytime, because nighttime it's little torturing to discuss milestones. So can we revise breastfeeding? Is it okay with you? out of the box question. USG can be done from which years of age? There is nothing, Amrit, there is nothing like that. We do newborn baby also, we do ultrasound. If the mother is if the mother is a case of oligohydramnios, I rule out renal agenesis in the baby, and I do ultrasound whole abdomen. It's as simple as that. Okay, tonight which topic? Tell me once. Breastfeeding or what do you call it? Vaccine? Tell me, tell me, tell me, tell me, tell me. Or breastfeeding. Okay, let's see. So day of appearance of rash. Day of appearance of rash. Yes, exactly. So very important. We have a mnemonic. Very sick people must take double tablets, but I don't remember the mnemonic. I directly know. If I have a fever today and a rash today itself, could you please tell me fever with rash on day one? Dr. Traveler says breakfast. Instead of breastfeeding, you wrote breakfast. Breakfast you want to discuss. If I have a fever today and I have got a rash today itself, what is the best answer you can give me? Of course, varicella, right? Chicken pox. Okay. Fever with rash on day one, you must think of chicken pox. Fever with rash on day 4, guys, what do you think of? Exactly. शुभांगी कह रही क्या? ओसामा जैसी हरकतें. ठीक है क्या? Okay, Dr. Mia says tonight tamanche pe disco. Okay, so fever with rash on day 4 will be measles. If I have got a fever today and rash came on day 7, day 7, anyone remind me? Typhoid fever, right? Typhoid fever, very good. If I have a fever with rash on day 5, could you please tell me fever with rash on day 5? Yes, very good. I'll have a scrub typhus. That's very true. And fever with rash on day 6, I will have dengue. Remember, it's not dengue, okay? In English, it's a dengue fever, okay? Next, fever with rash, very importantly, on day 2 and day 3. Can you please tell me? In day 2, you have scarlet fever. And in day 3, you will have smallpox. Now, this is a very important slide, okay? Very, very, very important slide. Did you understand this much? This is the fever with rash, okay? 5 more minutes, then this class is over. It's already 9:20. We have to finish this class. Shubham कहाँ पे है? Shubham समझ में आ रहा है, bro? Kaustubh, Osama, dear. Exactly. Amrit, हाँ, चलो. Very good, very good. Perfect. Can we move further? This is the fever with rash, okay? At the same time, we have something known as 5th disease and we have something known as 6th disease. Could you please tell me the names? This was the recent FMG question. 5th disease is also known as Erythema Infectiosum. 5th disease is also known as Erythema Infectiosum, and yeah, exactly. डॉक्टर अपेक्षा सेज थैंक यू सर, आपने क्लास में इतना अच्छा करवाया है, सारे टॉपिक याद हो गए हैं. दैट्स आई एम रियली हैप्पी डियर, आई एम ट्राइंग माय बेस्ट. एंड व्हाट इज सिक्स्थ डिजीज? सिक्स्थ डिजीज इज रोजियोला इन्फेंटम, right? I hope you're getting it. Okay, perfect. Please remember, there was a very huge doubt. Fever with rash on day 5 and day 6 is different, and 5th disease and 6th disease is different, okay? Don't confuse this. If I'm 5th disease is just the name, the other name of Erythema Infectiosum is 5th disease, but that does not mean that the patient is having fever with rash on day 5. Fever with rash on day 5 will be typhus only. Fever with rash on day 6 will be dengue. 6th disease and 5th disease are just the names. They are just the names. That does not mean that 5th disease मतलब fever with rash on day 5. No, it is just the name. ठीक है, एक तो ये बहुत क्लियर कर लीजिएगा अपने दिमाग में, ठीक है? Okay, let's move further. Oh, beautiful quote by Dr. Mother Teresa. If you're humble, nothing will touch you, either praise or disgrace. If you're humble, nothing will touch you, either praise or neither disgrace, because you know what you are. Okay, so it's a very beautiful quote. It's a very beautiful quote by Dr. Mother Teresa. If you're humble, be humble, nothing will touch you, either praise or disgrace. Really, people praising me, Dr. Anand, you teach so well, and I'm like, thank you. And someone saying me, you teach the worst, you are so bad, hopeless, you are so bad person. I'm like, thank you, because I have a different journey altogether. Be so busy in your dreams that you don't have time for critics. Be busy in your dreams. Your vision should be so strong. Your vision should be so strong. You should be so busy in improving yourself that you should not have time for critics, that she said me about me, he said bad about me. Anand sir, they were saying they were abusing you and all that. Let them abuse. It's their mouth, their way. I don't have time. Why? I have a different journey. I have got a BMW Grand Limousine. You know how much that cost? I mean, I'm the youngest in my family. In my whole, the generation, no one has got a BMW Grand Limousine, and I'm the youngest in my whole colony, in my family, who has got such a huge, expensive car in such a young age of life. Why? Why? I have a vision. I have a dream. I have a vision. I'm clearing that vision, and I'm very proud of it. So, are you proud of yourself? You also should have a vision. Okay, let's start. Yes, so this part is over. From day 1 to day 7 is perfectly fine. Let's move further. If I show you this image based question, if I show you this image, beautiful question exactly, could you please tell me what is the answer for this one? Yes, very good. Yes, Dr. Nikita, very beautiful. This looks like a strawberry tongue. Yeah, it's like a strawberry tongue. And where do you see strawberry tongue? Two conditions. Of course, Kawasaki disease, you see strawberry tongue. And also in a case of scarlet fever. And also in a case of scarlet fever. Beautiful. मोती की तरह सारी चीजें cover करनी है. With a simple, beautiful way, we'll clear the whole stuff. This is scarlet fever. Okay, next question. Yeah, this is a very nice picture. What do you think? Anyone? Dr. Osama, Apeksha, Kaustov, Shubham. Yes, yes, yes. Yes, we have Dr. Anshu Behel. He says, "Hi sir, I'm exam going, final year pediatrics resident. Your videos are so helpful. Thank you sir once again." Thank you so much. I'm nothing without your support, and keep watching the content. It's amazing. Yes, exactly. Yeah. So what is this, guys? Could you please answer? We have a traveler. He says, "I have Hyundai Eon. Eon is good. I had a Nano also. That was also very awesome." Exactly. So this is not okay. I have a hint. What is this exact? क्या बोलते हैं ये? नाम क्या है इस चीज का? Okay. Yes, definitely scarlet fever. Yes, Mahira is right. Gunjan is right. It is seen in scarlet fever. But बोलते क्या है इसको? What is the name of this thing? Could you tell me the name? Dr. Osama. नाम शुभम कहाँ पे है? शुभम नाम बता इसका. इधर आ तू. नाम बता इसका क्या है ये? क्या बोलते हैं इसको? एग्जैक्टली सैंड पेपर. वेरी इंपॉर्टेंटली सैंड पेपर रैश. ब्यूटीफुल पिक्चर. सैंड पेपर रैश. ओके, सैंड पेपर. सैंड जो होता है ना, जब ये, कैन यू सी दैट दिस वन राइट, व्हाइल मेकिंग द हाउस, द वॉल्स, राइट, वी हैव अ सैंड पेपर जो खरोचते हैं, ऐसे क्लीन करते हैं. दैट ओनली, दैट सैंड पेपर रैश. सो सैंड पेपर रैश इज सीन इन स्कारलेट फीवर. एग्जैक्टली, परफेक्ट. नाउ कम टू द मीजल्स, राइट. सो लास्ट 5 minutes एंड दिस क्लास इज ओवर. हाँ, फ्लोर मैट नहीं है ये, वो सैंड पेपर है डॉक्टर Pradesha. Okay, yeah, measles. Okay, what is the other name? Let's have top 10 questions on measles. Beautiful questions. What is the other name of measles? First question. It's like a revision class, right? Within 1 week you have your main exam, so just keep talking. Okay, हाँ जी, शुभम कहाँ पे है? हाँ ठीक है, very good. So beautiful. Dr. Shubham, can we please thank Dr. Shubham? Dr. Shubham says sandpaper rash is seen in scarlet fever. Sandpaper rash is seen in scarlet fever. And sandpaper nails, where do you see sandpaper nails? Alopecia areata. Alopecia areata. Very good. So it's a very beautiful, see, link and study. Okay, integrated link and study. Whole syllabus will never get over. You have to study the most high yield content. You have to link and study. So Nagayama spot, roseola infantum. Nakayama strain used in Japanese encephalitis. Same way, no? So sandpaper rash is seen in scarlet fever. How will I remember? S for sand, S for scarlet. So simple. S for sand, S for scarlet, right? And sandpaper nails, it is seen in alopecia areata. Please, can we thank Dr. Shubham, who is going to gym nowadays, who has been influenced by Dr. Osama and who is going gym nowadays. Great, perfect. Let's move further. What is the other name of measles? किसने, किसी समझदार ने आंसर किया? तो सबको आता है. Very good. The other name of measles is rubiola. Rubiola is the, it's not rubella, it's rubiola, right? Number 1. Number 2, yes, we're going to talk about causes, incubation period, pathology, clinical features and complications. Let's quickly start off. Yes, very beautiful. In a busy OPD, if the patient comes, and Dr. Shubham, you are there with me in the OPD, and Dr. Shubham says, sir एक बच्चा एडमिट किया, मेरे को मीजल्स लग रहा है. Sir, I have admitted one child. I think it's a case of measles. Very quickly, can you please tell me how can we remember? अच्छा, Osama, हर कोई शुभ, thank you, thank you, thank you. Cute, very cute. So remember 3 C's, right? Can we please remember cough, coryza, and conjunctivitis? Very quick, 4 more minutes, then this class is over. Tonight 11 p.m. I think we're gonna continue this infectious disease only. बहुत सारा है आगे. Okay, exactly. Cough, coryza, and conjunctivitis. Very beautiful question. Done. So FMG question number 71. Conjunctivitis. In a patient of measles, खांसी है. Do you have cough? Yes, doctor, I have cough. Do you have running nose? Yeah. Yes, doctor, running nose. Do you have conjunctivitis? Yes, doctor, there is a reddishness around my eyes. So do you see purulent conjunctivitis or a non-purulent conjunctivitis in the measles? What do you think? Very beautiful. Yes, Osama answering very good. Nikita also. You will have a purulent conjunctivitis. Doctor, there is some sticky thing, what you called going with the eyes. So nothing but purulent conjunctivitis. And in your OPD, whenever you see a case of measles, always do the reporting. You need to report the measles, okay? To the WHO center, we have mobile numbers and everything. You need to report for the measles, okay? Remember that. And Kawasaki will have a non-purulent. Conjunctivitis. Beautiful, perfect answer. Next question, very important. What is the cause? हाँ जी, आगे आ जाओ मार खाने के लिए. हाँ जी, कौन बताएगा? Beautiful. Dr. Shubham, Dr. Swaraj, Nikita, Mahira, and Shubhangi Kaushik. What is the cause? It is caused by bacteria. Measles is, okay, I have a question. Measles is caused by a protozoa or measles is caused by a fungus? हाँ जी, quick answer. Measles is caused by protozoa or a fungus? Who will tell me? Raise your hands. Very beautiful people. Yes, it is caused by a virus. So RNA virus, measles virus. The family is Paramyxoviridae. Please tell your brains you are reading this for the first and last time. Okay, so measles is caused by a RNA virus. It is Viridae family. Most important. Incubation period. Very quick. Incubation period क्या होता है measles का? 7 to 10 days, 10 to 21 days. What do you think, guys? Last 2 minutes. Exactly. It's roughly around, 1 week plus 8 to 12 days. 8 to 12 days. Remember, okay, because after that we're going to talk about mumps. After that we're going to talk about chicken pox. Okay, infectious disease we have covered, right? Then we talk about this one, typhoid fever, then enteric fever. These are the 5 diseases: measles, mumps, chicken pox, enteric, and dengue fever is the thought of choice. We're going to cover these 5 infectious diseases. Incubation period is important. Okay, roughly around 1 week. Okay, 8 to 12 days. Take at least 1 week plus, remember. Okay, and keep your brains very light. Okay, life is beautiful. Don't stress. 8 to 12. Okay, 8 to 12, roughly around, keep it at 10 days. That's it. Simple. 10 plus minus 2, right? Can I say that? 10 plus minus 2. Keep it very light. Don't really stress yourself. ऐसा नहीं करना. ठीक है, next question. हाँ जी, pathology. Okay, so yeah, okay, कहाँ से शुरू करूँ? Okay, what are the spots do we see in a case of measles? I think everyone knows. Oscar को भी पता है, मेरे doggy को भी ये answer पता है. We see Koplik spots, right? This one, right? Just now we spoke about it. Yes, exactly. Dr. Manish is right. Toxoplasma is a protozoa. I totally agree with you. And measles is a virus. Okay, Koplik spots, we spoke about it, right? They are the red lesion with the white spots. Can I write? They are the red, right? They are the red lesions with the white spot. They are the red lesion with the white spots over the in my cheek, opposite to the first and second molar, right? This part is over. Okay, perfect. Okay, very importantly, and yes, now please remember this one more thing. Okay, period of communicability. So -3 and +5, 3 days before the rash and 5 days after. 3 days before and 5 days after the rash is the period of communicability. If you are having measles, when should I visit you? So 3 days before and 5 days after the rash, I should not visit you, because that is the period of communicability. Incubation period 10 plus minus 2 days, and yeah, exactly. So, and period of communicability -3 and +5. -3 and +5. Remember, yeah, exactly. Rash days free. So rash days free. Rash day free nahi hai. The day I'm having rash is a bad thing. If if 3 days before the rash and 5 days after the rash, that whole point area I should not meet anyone because the chances of period of communicability is there. Okay, remember that. Take a exactly, sir. So rash. I didn't get you. Okay, that's it. Okay, then the pathognomic sign of measles, very important, is definitely Koplik spots, exactly. And also at the same time we have something known as Warthin-Finkelday giant cells. Yes, that's very true. Warthin-Finkelday giant cells is very important image based question. This one, can you see that this multi-nucleated giant cell, this is multi-nucleated, right? Lot of nucleus are there. So this multi-nucleated giant cells in my lymph nodes, exactly. Amrit Sehu is right. 3 days before कैसे पता चलेगा? वो भगवान को ही पता चलेगा, पता चल ही नहीं सकता. Obviously that's right only, but prodromal symptoms and all that you will get kind of a thing, fever with rash and all that, but nahi pata chalega, obviously, dear. Yeah, exactly. And this part is over. Let's finish it now. So now what are we studying? Measles. Okay, please, last 1 minute, put your strongest positive vibes in this class. Please read. Can I say that rash of the measles begins on the forehead, behind the ear, and spread to the torso and extremities? Is this line yes or is the line false? Could you please tell me? Very important. So rash begins on the forehead, behind the ear, and spread at the torso and the extremity. Number 1. Number 2, it fades by 7th day. Remember, it is fever with rash on day 4, right? Think, okay, at day 4 I got the rash which is behind my ear and face and trunk and this and that. By 7th day it will go off. Okay, this is another set of information we must know. Also at the same time, can I write that the Koplik spots are pathognomic sign of measles? Even both, okay. Warthin-Finkelday giant cells also, this one, Warthin-Finkelday giant cells also are pathognomic, and Koplik spots are also pathognomic, right? Right or wrong? Right, exactly. Someone, I think this Pradesha only, she asked me, when will you expect the Koplik spots? They appear 1 to 4 days after the onset of rash. 1 to 4 days after the onset of rash. Means if I have a fever with rash, normally which day you get the rash? Day 4. Day 4 you get the rash. By day 7 rash also will go, but 1 to 4 days after the rash, that means this area, day 5, day 6, day 7, day 8, I can get Koplik spots. Please remember, okay, when are you getting the rash? Fever with rash on day 4. Rash you will get on day 4, and after, like, Koplik spots appears 1 to 4 days after the onset of rash. So means, can we appreciate, first I'll get the rash and then I will get the Koplik spots, right? Koplik spots, remember that, okay? And star mark, this was the actually exam question, that this Koplik spots, right, opposite to the first and second molar over my cheeks. Can you see this on the vagina mucosa? The answer is yes. Can I see on the eyes conjunctival folds? Yes. So Koplik spots is just not only over here, it can be seen over the vaginal mucosa and the conjunctival folds. That finishes today's class. Is already 60 minutes over. उससे ज़्यादा मैं पढ़ाता नहीं हूँ. So tonight 11 p.m. we're gonna cover the continuation of the what you call topics of this one of the class. Thank you so much everyone. Last question. Did you understand something? Yes or yes? Exactly. समझ में आया कुछ? Yes or no? And then we're gonna talk about SSP and all that. Yes, समझ में आया? Yes. Beautiful. Perfect. Okay, Osama has a very beautiful quote. Osama says, Osama का तो देखना पड़ता है मेरे को. Beautiful. So Osama has a very beautiful quote I would like to read. Osama says, फिर से बिखरने के लिए खुद को संवारा है. फिर से बिखरने के लिए खुद को संवारा है. एक कश्ती कागज की आज इस समुद्र में उतारा है. So that's very beautiful quote. I'll read again. फिर से बिखरने के लिए खुद को संवारा है. एक कश्ती कागज की आज इस समुद्र पे उतारा है. So that's very beautiful, very deep meaningful quote. Amazing. Thank you so much Dr. Osama. Again I'll read once again for the students. फिर से बिखरने के लिए खुद को संवारा है. एक कश्ती कागज की आज इस समुद्र पे उतारा है. So means hope should never die. hope should never die. That is the moral of the story. Amazing. Thank you so much, everyone. Thank you, Dr. Shubham, Jaya, Shubhangi, Osama, Apeksha, Pragya, Suraj, Akshay, Mahira, Nikita. So many amazing students we have. And before leaving, number one, we have a class at 11 p.m. tonight. Make sure you're free at 11 p.m. Special class. We're gonna continue measles, mumps, and so many diseases. Before leaving, we always have a motivating quote, and this beautiful quote says, great people are those who make others feel that they too can become great. This is such a genuinely right quote. Do you agree with this quote? Yes or no? Great people are those who make others feel that they too can become great. So don't downgrade your friends. Don't make any other person inferior. Don't make anyone negative. If you are really a genuine person, you will say that I inspire myself and I also inspire you. Okay, I had my juniors, they used to tell me, Anand sir, why are you teaching her? Don't teach her, no, teach me. I will do your homework. Okay, I will, whatever you will tell me to read, I'll read and come. Don't teach her. Why are you teaching her? Only you teach me. So don't do that. I always say sharing is caring, right? Share. We are here at the mankind, right, just to share beautiful knowledge. So very beautiful quote. Great people are those who make others feel that they too can become great, and that's like very genuinely right. Okay, thank you so much, everyone. Yes. Yes, that's true. अभी अब यहाँ शायर है हमारी क्लासेस में. So डॉक्टर मिया सेज, अगर कश्ती को समुद्र में उतारा है, अगर कश्ती को समुद्र में उतारा है तो उसे मंजिल तक भी पहुंचाना है. या बहुत ही डीप बात कही है आपने. दैट्स, आई एग्री विद यू. एंड डॉक्टर, वी हैव डॉक्टर मोहसिन अली. ही सेज लव फ्रॉम पाकिस्तान सर, लव फ्रॉम पाकिस्तान. थैंक यू so much. That's very kind of you. Dr. Shubham, thank you. Pragya, just like you, sir. Yes, my dear. And that's it. So, chalo, take care. And yes, exactly. Beautiful. So, thank you so much, everyone, for this wonderful participation. I had a wonderful time. I hope you guys had a beautiful time. See you tonight at 11 p.m. on our special class. Thank you. Take care and chill out.